Hi there, I'm with a patient who's here for a 4-month follow-up. It's a corrective procedure. He's had multiple procedures with the older style techniques, with some of the older style plugs. We did a max size case where we harvested from one side to the other side, moving as much possible donor tissue as we can move. I'm going to show you his old scars from his other doctors first, so you can get a feel for what he's had in the past. This is a scar from a previous doctor that took him all the way around. And it looks like they did the technique where they're pulling out the punches and then just kind of sewing it together. So this is an older style technique for harvesting the suture line. So this is not what we're trying to accomplish when we harvest the donor, because when the patients wear their hair shorter, it's harder for this to conceal. He's had multiple surgeries. Here's another example from one of his previous surgeries of what had happened. And as you can see, it's a little bit more of an unsightly scar. And this is another from his other doctor here. Okay, so what we were trying to do when we did this particular patient's procedure is maximize the amount of donor that we were to move. What I did is I took a fresh scar. I'm going to show you where my scar starts. My scar starts over here, and this is at 4 months, so this is going to continue to heal. So here's where I started over here. I did a max size case. This little thin trace line that you're seeing here. Okay, if you look at here, let's see if I can get this visualized. This is the scar that I left him. Okay. And then we're going to just kind of follow that around. So there's the scar right here. So that's the scar that I left him. And then this comes around like this. That's the scar. This is going to continue to heal. So here's the scar I left him. Here's the scar that he got at another facility. So other facility scar, other facility scar. Here's our scar down here. Okay. So if it's not done with the proper technique, and you can see the difference of how it's going to heal. So here's what we did once again. Here's what he had in another clinic. So let's go back to ours. Follow this around. Comes around through here like this. And I'm going to take you the whole way so you can see the entire suture line. Here's the suture line here. So this is the line, and this is still completely unhealed. He's only at 4 months. So that's going to continue to heal. So this is the scar. This is once again the old scar above here. Here's his old scar above here, and here's our scar coming around through here. This is still part of the old scar. We went through that, and this is what we left them. This is the suture line right here.